Welcome to the ACC Update for June. I'm Lisa Fletcher. This special edition takes an important look at appropriate use criteria, or AUC. AUC are important tools designed to help cardiac care providers appropriately use new technologies and therapies. The college recently added a new set of AUC to its toolbox, which looks at appropriate use for diagnostic catheterization. Dr. Peter Block, editor of CardioSource Heart Minute, recently followed up on the topic.
The appropriate use criteria point out that indications for coronary angiography should include the clinical detection of obstructive coronary artery disease with and without prior non-invasive testing, or that the cath be part of a preoperative testing, or that the cath be part of an arrhythmia workup. Right heart catheterization reasons are provided by evaluation of native and prosthetic heart valve disease, assessment of cardiomyopathy, and evaluation, of course, of pulmonary hypertension. The use criteria also point out that asymptomatic patients at low risk for coronary disease or patients with good functional capacity and or needing low-risk surgery should not go directly to cardiac cath.
For more information on this study, visit the ACC In Touch blog post at blog.cardiosource.org. The ACCF, in partnership with key specialty and subspecialty societies, conducted a review of common clinical scenarios where non-invasive vascular testing is frequently considered. The AUC for Peripheral Vascular Ultrasound and Physiological Testing Part 1 Arterial will release online in mid-June and will publish in the July 10th issue of JACC. We'll be back after a brief message, and when we return, we're going to sit down with ACC Senior Vice President of Science and Quality, Dr. Bill Atchen. Stay with us.
Eligible providers who are not participating in the federal e-prescribing program face a 1.5% Medicare payment penalty unless a hardship exemption has been filed by June 30th. To get more information on key deadlines, visit cardiosource.org/healthit.
Welcome back. Joining me in the studio to talk more about appropriate use and the new studies is Dr. Bill Atchen, ACC Senior Vice President of Science and Quality. Dr. Atchen, thanks for being here.
Thanks so much for having me.
Talk a little bit about how appropriate use criteria are developed.
Well, appropriate use criteria are developed by the college through a technique that's been around for several decades. It's called the modified Delphi technique. And the way it works is that a series of clinical scenarios are developed and presented to a panel of expert cardiologists, and they're asked to go through the exercise of determining whether a given test, for instance cardiac catheterization, would be appropriate in that particular scenario. So the individual panel members will rate each of the scenarios themselves and then provide that data to the appropriate use criteria panel, and then the results are collated, and those first ratings are done privately, and then the results are collated, and then all of the panelists are pulled together and the exercise is repeated, and then following discussion among the panel members of why they think the various ratings should be applied, a consensus is developed from the panel, and those are the final ratings and determinations of appropriate or inappropriate or uncertain.
And then from there, how do CV professionals use those criteria?
Well, they can be used in a number of ways. Probably the most effective way is for a physician to check his or her clinical judgment against the appropriate use criteria for a given scenario. Most of the time, most physicians know what should be done and do it by training and almost instinctively. But there are certain cases where it will be helpful for the physician to refer to the AUCs for guidance. AUCs are not hard and fast requirements. As in every clinical situation, clinical judgment is necessary, but they're guidelines, and they're consensus-driven guidelines. So they're very important.
Can you give us some of the highlights of the two new AUC documents?
Well, the one that's been published most recently is Appropriate Use Criteria for Diagnostic Cardiac Catheterizations, and it's a panel that was chaired by Dr. Manesh Patel. There are multiple organizations that have contributed to this, And they've looked at a total of 166 clinical scenarios and have rated them. So they're quite helpful. They don't cover obviously every possible clinical scenario, but a good number of the most common. So that will be it will be very helpful to practicing cathing cardiologists. The next document that's in line for publication, which will come out in early June, is a publication on the use of peripheral ultrasound in physiologic testing. And again, this is a consensus AUC document. Multiple different organizations have been contributors to this, and it's being chaired by Dr. Emil Moeller. So we haven't really seen that yet. We don't know exactly what the results of our recommendations are going to be, but we're looking forward to that. And they again are looking at about 160 different clinical scenarios. So,
Dr. Bill Otchen, thanks for taking some time with us today.
You're very welcome.
Appreciate it.
Thank you.
That's all for us for this month's ACC update, but stay tuned again next month. And in the meantime, you can go to CardioSource for all the latest news from your college. I'm Lisa Fletcher. Thanks for watching.